Welcome, everyone, to Healthcare Leadership Live. I am your host, Mike Lyons, an HR services provider focused on healthcare, and I'm absolutely thrilled that you're joining us here today. Whether you're tuning in to the podcast or joining our live stream, you're in the right place if you're a leader in a small or growing healthcare business who's hungry for actionable tips to propel your growth. Today's guest is Dr. Blake Hampton, an ophthalmologist in North Carolina. And he's graciously agreed to join us here today and talk about ophthalmology and the business of ophthalmology and share all of his wisdom that he's got.
I appreciate that, Mike. Thank you for having me. It's always fun to talk to you. So,
Yeah,
yeah, looking forward to our conversation today.
awesome. Well, thank you so much for being here. And as always, the show is sponsored by Seasoned Advice HR Services, where I help small and medium sized healthcare businesses retain employees better and get better results from your people. And so, starting out, Blake, why don't you just tell us, about you and why
Sure,
you do this thing called ophthalmology?
sure. Yeah. So, I'm originally from South Florida and moved to North Carolina really because my wife's actually a resident at Duke. She's studying ears, nose, and throat there. So that's what brought me to the area to practice ophthalmology. So I'm a comprehensive ophthalmologist and cataract surgeon, and about 3 years into practice now. So, I joined a smaller group practice. There's like four full-time comprehensive ophthalmologists, and then some part-time and some subspecialists that we contract through UNC in Chapel Hill for like retina, glaucoma, and oculoplastics. So yeah, I mean, it's a big learning experience going from residency and training, for all those years, and then actually entering, the quote unquote real world. So I've definitely learned a lot over the last few years. I don't know how many pearls of wisdom, I'll be able to share with you, but I'm happy to dig into it. It's definitely something I'm really passionate about. Beyond the clinical and surgical side of things, which I really do enjoy. Like you said, there's this whole business aspect of it
Mhm.
that we really, you can't hide from it if you want to deliver good patient care. So, it's important to address it as best we can.
Yeah. Well, I mean, with that, what's maybe one or two eye-opening things since you have joined private practice that
Yes,
maybe you didn't expect coming out of.
sure. Yeah. So for me, I did my residency at Nassau Medical Center in Long Island in New York,
Mhm.
and it's a county hospital. There's unions. Expecting the people working there to really go above and beyond, the call of duty is not realistic. It's
Mhm.
just the reality of it. And I figured going from that environment to a private practice, you would just there would be more of a meritocracy. There would be like inherent efficiencies, and unfortunately, that's not necessarily true. We have similar issues contending with human behavior, as we've discussed before. Just reimbursement cuts and staying competitive wage wise with industries outside of medicine. It can make it difficult to hire, train, retain, good staff. And, obviously super important what you're doing is we certainly need help with that. So I'd say that was a big eye opener for me. I was just expecting like meritocracy, efficiency, everyone, really doing their best to take care of the patient. So I'd say that was probably number one. Other eye openers, let's see. Um, I think for anyone who's starting out in practice, you're going to have your own biases, conceptions of how things should be done. And it's good to just be open minded. Different people do things different ways. Everything's got its pros and cons. And, you're going to continue to learn and absorb things, kind of discard things that you tried that didn't really work. And that's all part of the process. So, maybe I had this expectation that like once I hit practice, I just like these were the ways I was going to be doing everything. And the reality is it's much more of a continuous process.
Mm.
Yeah.
Well, I'm a big fan of, you talked about people's engagement and unions and
Right.
meritocracy. I
Right.
mean, yeah, really, it's disappointing, right? When
Yeah.
when people don't have the same drive that you
Right.
bring into
Of
something.
course. Yeah.
Yeah.
Yeah. Definitely can be very frustrating.
Are there any? Or have you picked up any nuggets, or have you tried anything in practice that you think helps with the team around you? Because in ophthalmology,
Right.
you've got this team around you, and you really rely on them. Have there been any things that you've been able to figure out to help bring motivation up maybe a little bit, or engagement of the team?
It's little things that you could easily ignore, that
Mm,
I do think make a big difference. It's like tending a garden. You just have to like periodically like check in and see like how are
mhm,
people doing, like beyond just like what's going on at work. Like it's very easy to just focus on all the negatives. These are the things that were not done, they were not done correctly, and
mm,
we need to address these. But the reality is everyone has a life outside of the clinic. And of course, I think the classic attitude to that is check all that stuff at the door. But it's easier said than done. We're
mhm.
humans, and naturally people are going to bring some of that stuff inside with them. And I think the better way of addressing it is just being open about it, talking a little bit about, that stuff outside, rather than just like trying to suppress it, ignore it, or, sugarcoat it, and just like try to focus on, because not everyone can compartmentalize as well as a typical like ophthalmologist or surgeon. It's like we have to be able
Yeah.
to be really good at that. And so we have to acknowledge that some of
Mhm.
that is going to um, impact the day to day. And I think people do appreciate when you actually check in on them and talk more about what's going on with their life, and how you could potentially help a little bit maybe.
Yeah, you're so right. That's something that I preach a lot, is connecting with your team. And you're talking about positivity, but not toxic positivity, right?
Right.
We're gonna
Right.
we're gonna get real and like, hey, what's going on? And you're exactly right. Getting to know people is super, super important.
Yeah.
Um, and the whole goal here, right, is patient care,
Right.
and taking care of them, and being productive, right?
Right.
And there is a business side right here
Right.
of, and I've seen it in a couple of different practices, that the doctor productivity really matters so much, right?
Of course.
And so what do you feel like has helped you, or made the most difference in your own productivity in the clinic?
Well, when you say productivity, that could mean a lot of different things. So tell me a little bit more, what you mean.
Yeah, so we're talking how many patients you can see in a
Oh,
day,
sure.
right? How
Yeah.
many cases, right? You can
Yeah.
get through, because
Yeah.
look, it is a business, right? Obviously, there is patient
Right.
care, but
Right.
there's also an economic side.
Oh,
So
absolutely. Yeah.
yeah,
You know, again, these are things that I kind of just picked up along the way. It's reviewing stuff ahead of time, even for a little bit. Figuring out, okay, the patient's coming in for X, Y, and Z. We're going to need certain tests ordered, for
mhm,
those patients. The more senior seasoned technicians may know to get that stuff, but the junior, newer technicians may not. And so, teeing that up, leaving a little note in the EHR, like these are the things we're going to need for this patient. Uh,
mm,
you may not really think of it as making that much of an impact, but honestly, like the difference between a patient getting the right imaging and not before I see them can create like a massive differential in the amount of time spent, for that single patient. they have to go back to the waiting area. They have to wait for an imaging device to open up. They have to get the imaging. They have to come back to the waiting room, then back to the exam room. I mean, that's not good, right? So little things, but I think it's very easy for me and probably a lot of doctors to just say, well, that's not my job.
Mhm.
That's for someone else to figure out. That's for the head technician or the practice administrator to train the technicians to know what to do. And the reality is it's a group effort. We can all contribute. At the end of the day, the clinician is going to be the one determining, what tests need to be done or what tests they want to be done. So, how far removed should I be from that? It's like, so I do think it helps to review stuff ahead of time. Look at the clinic schedule. Even for my OR schedule, I think some docs do this, some don't. But like, for example, I've got my packet for Thursday I'm operating, and I'm going to order the cases from easiest to hardest. And,
Mhm.
some people like to knock out the hardest ones at the beginning. The way I see it is like, let's leave the potential, like, variable length cases to the end
Mm.
and just get us all in the swing of things. I'm all about entering that state of flow. And, the sooner we get into that state of flow, the better.
Mm.
So I feel like that helps get the OR running smoothly. And then, clinic, it's easy for us to get bogged down, but I don't want to talk too much. I'll let you take the mic.
No, no, I'm digging it up. What I was thinking about when you were talking was what I have seen in ophthalmology is there's a lot to learn for the technician, and
Absolutely.
that's a good thing, and it's a challenge.
Right.
The good part about it is it offers an opportunity for them to have sort of advancement and career growth, right?
Right.
And
Right.
so the more you learn, the more you can progress in your career, the more valuable you are, and then presumably, hopefully, the more money you can earn.
Right.
And so, have you been able to spend time with your technicians, kind of educating them about imaging required for different cases and that kind of thing?
So that is really something that I'd like our practice to do better.
Mhm.
Really, and I don't, you would probably be able to speak to this better than me, but I think an ideal workflow really would be like like a brief pre-clinic huddle and like a post-clinic huddle. Really pre-clinic, like what are we in for? Who's doing what? Everyone kind of like just get in locked in,
Mm.
almost like, and I'm not like a huge sports person, but it's like for an effective team, almost everyone like, you have your whole spiel in the locker room, you get out on the court, right? You've got a general game plan. And then afterwards, it's like, okay, some things did not go according to our plan. Let's review, like, why did that not work? How can we support you better? It's easy for me to see a mistake and just say, that's your fault. You need to
Mhm.
fix that. But maybe there was some other variable going on that actually resulted in that mistake happening. So it's very easy to just like point the finger or have that like knee jerk response, like they need to do better. But we don't necessarily have the full picture. And I think the problem with like not addressing those things fairly real time is that it just gets left at the wayside, and it winds up propagating itself. And I think those huddles are great times for education, on, okay, you're having difficulty getting like good quality scans. Can someone here, show you how to get better quality scans?
Mm.
Because again, the result of lack of education is poor patient care. They wind up having to go back to get repeat images, et cetera. Thankfully, the technicians that are typically in my team, they've been doing this for years. So I'd say their education level is already excellent. And really, they are the ones that are oftentimes charged with educating the more junior,
Mm.
team members. And obviously it's nice for them to help in that role, but I do think sometimes it would be best to have me or the clinician
Mm.
really giving them the theory, because no one's going to understand the theory better. Because really, it's like when you don't understand the why and you're just doing it, how satisfying is that? And have told me, they want to understand why we do the things we do. And really, I love to teach, so I'm happy to do it. But we really need like protected time to do that, and I think the issue is we all want to just stay on the hamster wheel, and just like generate that revenue. But if you don't get off the hamster wheel to like actually look at the thing and say, you know what, we could probably fix a few things on the wheel so that when we get back on it, we can actually be more productive, then I think we're oftentimes getting in the way of ourselves, just, constantly trying to squeeze in as many patients and not having that protected time to actually, review things.
Well, you said you weren't sure that if you were going to have any nuggets for me, but what you just said there had a lot. You had a lot in there, right? So, I've definitely seen huddles used really effectively.
Mhm.
It's a great opportunity to educate the team and give insights. Medicine is one of the coolest businesses because how often do the staff get to work directly side by side with the subject matter expert, right? So
Right.
the technicians get to work with the doctor, and there's an educational thing that happens there, and there's like a really cool learning and a relationship that gets to happen. I love the after clinic thing because that's a great time to give the kudos and the appreciation and the look at what could have gone better. And man, now you're on a real flywheel of like learning and getting
Right.
better. And
Right.
and so, yeah, I think right there, you drop some knowledge bombs, and the why.
Yeah.
You're exactly right. People need to know the why, and when they don't understand the why, that's when they're suggesting things that don't make sense, or they take the patient through a flow that doesn't
Right.
work.
Right. Right.
And so, yeah, my hats off to you for trying to take that mantle on of education, because I really believe that your team is going to really enable your productivity.
Definitely.
Um, you know,
Absolutely.
so yeah, you've learned a lot here. You've in private practice,
Mhm.
and I'm thinking about doctors coming out of residency,
Right.
and maybe they're thinking about what path. Do I want to go work for a hospital, or what kind of business structure do I want to get into?
Right.
Have you, I don't know, what are you hearing from younger doctors coming out as far as their satisfaction with the situations they've come into? And
Right.
I don't know. I know there's obviously a lot of different things going on in the business of
Absolutely. Absolutely.
ophthalmology. So,
Right.
yeah, what are your thoughts there?
I mean, first of all, it's such an individual thing, and a lot of people don't know what they want coming
Mhm.
right out of residency, and that's okay. You oftentimes have to spend some time, just doing the work to figure out what you like, what you don't like, not just clinically, surgically, but like philosophically, some people love teaching, some people love research, some people
Mhm.
just want to, be in private practice. Um, some people want to be in clinic more, some people want to be operating more. There's so many facets to it. And so, no one size fits all, right? And that's okay. And I think, a lot of us come out of training with like a certain idea of what we are supposed to do, what we are expected to do. But at the end of the day, it's your life, and you got to live it. So you find what you like and
Mhm.
pursue that, and because otherwise, like you had, I think, were alluding to, we are looking at major burnout rates across the board, all ages. What I'm hearing is that people who are entering and graduating medical school are not even necessarily thinking of going into medicine, practicing medicine full time. Like a growing proportion of them
Mhm.
are just getting the degree and then doing something else,
Mhm.
which there's a reason for that, right? The scales have shifted, the economics have shifted, the quote unquote prestige of being a physician, is not what it used to be. And so I think a lot of people are looking at this and questioning, like, is this really something, I want to do for the rest of my life? But I'd say, be open-minded and listen to your personal, wants, needs, things that aggravate you, stress you, and seek out, what you like, and, let go of what you don't like, because, um, again, going back to patient care, productivity, it's a lot harder to deliver on those things if, you're working in an environment you're not happy in, or
Mhm.
doing things you don't want to be doing.
Yeah. Very wise advice, sage advice. I'm thinking of, back to ramping up your practice, and I always like to hear about marketing and how to grow, your business in healthcare. You said you've been at this for about 3 years here in private practice. What are things that you feel like made a difference in growing your slate of patients, your patient load there?
I mean, certainly, I do think word of mouth goes a long way, and I think everyone will agree that creating a positive patient experience um, pays for itself, moreover than typical like marketing,
Mm,
investments. So, I try to do my best, given the constraints that we practice under. Having to maintain higher volumes, only having so much chair time, with each patient. But maybe I'm a little old school. I like to shake everyone's hand. I like to greet them, and my hands tend to be freezing no matter what. So the patients are always like, cold hands, warm heart, or they're just like shocked, like, why is his hands like freezing cold? I guess, that's a bit of a doctor stereotype, but um, I shake hands at the beginning, at the end of every visit with every patient, even with the caregivers who come with them. I
mm,
offer to shake hands because I do feel like there has been a lot of loss of that human connection, and it makes it a lot easier to stand out, really, and to build and scale. Because I have plenty of patients who have come to my clinic. They had previously been followed with another doctor, and they're like, you know what, I'm switching to you. And I'm not like trying to step on toes or steal patients or anything, but you treat patients with respect, treat them the way you would want your own family members to be treated. And I think that goes a long way to, building up the volume. Obviously, taking, good clinical surgical care of patients, having good outcomes, and also not brushing bad outcomes under the rug, or trying
mm.
to, just like move on. Because certainly that's how you get in big trouble. This is something I've heard multiple doctors and ophthalmologists talk about. You really want to run towards those patients, so it's important to be there, especially for the patients that are not, going the way you want them to.
Mm. I do want to say, for those watching live here on LinkedIn, if you have a comment or a question for Blake, drop that into the LinkedIn comments section and we will respond or react. Always have a hat on. So if you have something to say about my hat, you like my hat, you don't like it, give me, I'd love to hear your feedback there. If you think this conversation is going great, let us know. This is your opportunity. Um, I'm wondering, obviously people matter a lot to me and they matter a lot to you for sure. Do you notice when there's employee turnover in the office, and like what kind of effect does that have?
Oh, for sure. It's very much a vicious cycle. And of course, there's only so much you can do. And I'm sure you could speak to this. There's a lot you can probably do to help reduce issues with turnover. But uh, the fact is, it's not good for morale, right? To see people coming and going.
Mm,
Um, and so, of course, you want to understand the reasons behind why individuals are leaving. Everyone has, their own reasons, and
mhm,
it's not necessarily a poor reflection on their experience or the practice. They could be leaving for legitimate reasons. Maybe they have a better career opportunity, maybe their spouse is moving or their partner, whatever it is, and so they have to move. And I think there is a good way to send off, employees or team members, um, on a positive note, and leaving the door open. We wish you well in, whatever you're doing in your endeavors. And, we had a great experience with you, and we're happy to, welcome you back to the practice, as opposed to, some people taking it personally and saying, well, if you're leaving, I never want to see you again. you know and of course there are times where it's not a good fit, there's not good work ethic. We've tried again, and we're just not getting. That's a different situation.
Yeah.
But I think it's important to dissect, like, what is that turnover actually. You could easily paint it as, oh, it's bad. Turnover 100% of the time is a bad thing. Well, not necessarily. I mean, people, there are legitimate reasons for people leaving and coming and going. So, it's easy to kind of blanket statement that,
Mhm.
but in general, I would say too much turnover, definitely bad for morale. Not, we want to do what we can to mitigate that.
Okay, very good. Um, there's innovation happening in ophthalmology and new technology. What are some technologies that you're using or that you're thinking about that you think are maybe necessary or at least helpful in your practice or potentially helpful that are kind of most interesting to you right now?
Yeah, so I mean, of course, first history has kind of been this thing that I've been working on for a while. And I appreciate you tuning into the webinar yesterday, and I got that posted up on LinkedIn for anyone who's interested. But it goes back to that patient experience. Technology can be used to improve patient experience, practice efficiency, productivity. I'm a millennial. I was born and raised in the digital age, and so for me, it's intuitive. It makes sense to incorporate these tools. I think it's very easy to look at technologies, or expect patients to use technologies and say, they're never going to use that. And there is some, like, baked in discrimination there, age discrimination. Just because someone's older does not mean they're not tech savvy. And I think the data has really borne that out. Not only within my practice, where I have 80-plus-year-olds who are providing excellent histories before they walk through the door, using first history, but then across the larger first history pool. And for people who are watching this, first history is a pre-engagement platform. It automates the medical interview, it educates patients, screens them for trials, and basically provides a lot of great resources for practices, including analytics and breakdowns of why patients are presenting, and how they're responding to the content that you present to them. So there's a lot of cool things that you can do with it. And I found that in my clinic, using it the past year, it helps mitigate a lot of those issues with turnover, with newer technicians not
Mm,
necessarily knowing what questions to ask and when. And that can really be a point of frustration. So this really helps iron out some of those wrinkles, because it's already done. They can fill in the gaps here and there, but it takes a lot of the pressure off of the technicians to try
mm,
to gather all this information in a short window, and get onto the exam. And it can help tee up, like, what are we doing, like, for this patient, if we already have some of that information ahead of time. So that's something that has been very helpful for
mm.
me. And certainly I'm super interested in other technologies and solutions, and I'm happy to talk about the ones that I'm familiar with, even the ones that we're not using in our practice, that I do think make a lot of sense for modern eye care.
Sure. Yeah. Is there one that comes to mind that you're interested in? You're excited about?
Yeah, well, I think for more the administrative side, appointment reminders, re-engaging patients who have not necessarily been to the practice in a while, or you're just trying to get them back in. There's a few, right? There's Clearwave and Brevium and Next Patient. So these are all options that help make sure, if you've got a slot for a patient, increase that show rate, decrease the no show rate. make sure patients are coming in, fairly on time, not so late. And then, making sure you're not losing patients who really need to be seen on a regular basis. Obviously, glaucoma is an important one, macular degeneration, diabetic retinopathy. A lot of these patients need to be followed pretty closely. So, beyond just maintaining a productive practice, but also making sure the patients are being taken care of. These are all areas where technology helps, and of course, it would be nice to have an individual calling every patient for everything every time. It's very resource intensive, so technology can help mitigate that. And frankly, some patients and an increasing percentage of patients, Gen Z, Alpha, Millennials, Gen X to some degree, they prefer, the the digital interface a lot of the time over, a phone call or talking to someone in person. So meet the patient where they are. Give them the option to connect with you the way they like to.
That's really interesting because there are technologies in HR for some of the same types of things, like so recruiting,
Mhm.
interviewing. You can have an AI agent do an video interview. You can onboard. I don't know where for sure with all of that stuff, but one thing I
Right,
do believe is that our workforce is probably not going to keep pace
right,
with the demand. And so these tools may seem threatening to current employees, but
right,
really they're going to help enable growth,
right.
I think, in the long run. Is that your perspective on that?
Absolutely. And I haven't experienced this in my practice with First History. I think the technicians are happy to have like this little life raft, being thrown, you know, um, to the point where they're asking like, why are the other docs not using this?
Ah,
But certainly, I've heard in other scenarios where First History is being deployed, in maybe like an ER triage situation where there's a triage nurse, and now all of a sudden First History is doing some of that work, and
yeah.
naturally they're going to be threatened by that, right? So
Mm,
I think a lot of it is perspective, because the reality is, like you said, the demand is so much higher than the supply. The workforce as it is not enough, and this discrepancy is only going to get worse. This mismatch is only going to get worse, right? So I would take someone like that triage nurse and say, listen, you're going to be able to triage a whole lot more people,
mm,
as opposed to we're going to use this in place of you, and
mm,
I think it's a philosophical thing. I think it's very natural for people to be threatened by new things, different things that they're not familiar with. But the reality is we need these resources to augment our workforce. I mean, I honestly, just looking at like 10 years ahead, I'm hearing more about like automated slit lamp exams, automated, like, of course, like auto refractions, but even like manifest subjective refractions. Um, and so we're just, these are the tools we'll need to, serve a higher volume of patients. Let alone the fact that with decreasing reimbursements, that's driving higher volumes anyways, just to maintain, similar degree of profitability. But yeah, I think it's just the reality, and over time, people will look at it no different than an iPhone, Chat GPT. It just it becomes part of the norm, the culture. So
mhm.
those things are scary, right?
Yeah, it can be. It can
Yeah,
be.
yeah,
Um, yeah, you kind of touched on something I was going to get into, which is what can practices do like to prepare for the future, right? So it sounds
mhm,
like technology, maybe one. Also, kind of touched on reimbursement
yeah.
declines, and I don't know, where does your mind go around how healthcare deals with that, and how private practice maybe specifically copes with that.
Yeah. I mean, the reality is certain practices, certain fields within medicine are better equipped to dissociate from CMS-based, insurance-based
Mm,
reimbursements. And I'd say ophthalmology, parts of ophthalmology anyway, are very lucky that we have some of these options where we're not completely tied to insurance,
mm,
for reimbursement. Of course, naturally, you don't want to sell someone something that they don't need, right? And it only makes sense that people are going to see this as you're just trying to squeeze the patients for every dollar that you can. And so we have to get in front of that, and be
mm,
like, be honest, right? Be honest about the situation. Like no one asked for decreased, reimbursements, right? If practices want to maintain a degree of profitability that is sustainable in the long term, they have to be looking to other sources of revenue. I mean, you can only cut overhead expenses so much, and the reality is they're growing. Inflation.
right.
Employee wages, it's all going up, right? So something's got to give. I mean, people are fleeing, medicine in droves, right? Doctors are retiring early. We're seeing more and more consolidation amongst large group practices, of course, like hospitals, private equity, venture capital backed groups. And I have no doubt that this is not good, for the patient.
Mm,
That's the reality of it. But it's inevitable that we're going to see continued consolidation as long as the individual private practice is being financially, squeezed the way it has been for so many years now. So, um, what can an individual practice do to mitigate this? Yes, out of pocket services, dry eye, premium cataract surgery, refractive surgery, cosmetics, aesthetics.
mm,
But again, not all practices serve those types of patients that would benefit from those um, types of procedures and technologies. So then you really have to start thinking outside the box. Are you going to pivot? Try to do something a little different to generate additional revenue. Um, it's not easy, no matter what. It's not easy, but people will have to find a way, or basically we're all looking at being employed by, large corporation.
mm.
Whether that corporation has an academic, logo, or PE logo, or, large group practice logo. That's what we're looking at. I mean, I'm sure you've seen the graphs, the number of employed physicians over time.
Mhm.
And meanwhile, the reimbursement rates stagnating and the administrative costs, going through the roof. So this, unfortunately, this is the system where we are finding ourselves, facing. But it'll be interesting to see how it plays out.
Yes, and I wish that I had answers
Yeah,
for you on that. I wish I had answers for all of us here, right? Because we're all people here living in America who have our own healthcare needs and our own healthcare expenses
right,
and our own family members who need care and sustainable system that works for everybody.
right.
There's always TikTok. If you want to become an influencer, I know I know a couple doctors that make more money as TikTok influencers
That's a
than
good point. It's true. I mean, people are definitely, you see a lot more doctors going on social media now, definitely.
yeah. So with so much craziness, right? We've talked about crazy packed schedules. We've talked about declining reimbursements, employee turnover. How do you? I'm big on self care. I'm big
Yeah.
on having balance and looking at your life in a holistic way and taking care of yourself. How do you? As Dr. Hampton, how do you take care of yourself on a daily basis?
The truth is, my balance has gone out the window like the last couple of years, and I really hope to get it back. I do, and it takes intention to do that. The reality is, my wife's super busy with residency. We've got an 18-month-old girl who I'm obsessed with.
Mm,
And so some of those priorities certainly took a back seat, and we're settling into, being parents and professionals. But it's so important, right? To kind of nourish yourself to make sure that you're ready. And really, my daughter has become that that balance, because
mm,
at the end of the day, no matter how stressful it's been, spending time with her, really, it fills me up. It's just, it's a great thing. And, um, we're very fortunate to have that in our lives. Of course, the flip side is, waking up in the middle of the night. Thankfully, she sleeps through the night now. But yeah, it is really important to find that balance. I think the modern practice demands the like typical, Monday through Friday, 8 to 5, whatever it is, call schedule, etc. Taking care of administrative tasks before and after, maybe having a significant commute, it just chips away at the day, and then there's not a whole lot left.
mm,
And you approach practices and say, hey, I want to do a different model, and they're like, well, that's not how we've done things for the last, 50 years. But it's actually not the same model, because there was a time where there was such a higher degree of revenue,
mm,
and reimbursement rates, that you weren't working nearly as hard. Even if you were working the same number of hours, the
mm,
amount you're doing nowadays in those hours versus then, I mean, it's night and day, right? They used to talk about like doing a couple of cataract, like a cataract surgery per hour, you know, and that being like a good rate, right? So um, we really need to like address the fact that, like, yeah, it's a 40-hour work week, but it's actually like quadruple the amount of work that we did once upon a time not too long ago.
mm,
So it's I think we're going to see more variation in practice models, more locums, more part time,
mm.
because it can easily result in you not having that time to take care of yourself, and take care of those other parts of your life, which you really need to for the long haul. You can't be
Yeah.
burning both ends
Yeah, well,
indefinitely.
they say you talked about your family, and social connection is absolutely one of the best ways of taking care of yourself. And
Mhm.
man, I've got a few kids myself, and that is a wonderful way to give yourself purpose and connection.
Mhm.
And I love it when the kids are behaving and
Of course.
and they're all home.
Right, of
But
course.
I can totally identify with that. And
That's
so,
great.
not to suggest at all
Mhm.
that medicine is not your path or your calling, but if you couldn't practice ophthalmology, what would you do? What career path do you think you might follow?
Yeah, I mean, the true, like, heart of heart answers is I really cannot envision myself doing anything besides this, and really cataract surgery. I do find it super satisfying. I was a trained classical pianist for years. I played piano from like age 5, and I took lessons all the way through into medical school, actually, with a number of different piano teachers along the way. And I never actually looked at playing piano as a career. I always found it just like, I enjoyed it as a hobby, really, and I got good at it. And then cataract surgery basically became that new like technical skill that had the additional, like, extremely satisfying component of helping patients see better, and just them being so happy and grateful, and seeing the difference it makes in their quality of life. There's nothing like it, So,
Mm.
yes, like I had mentioned to you previously, I had that idea of being like a stand-up comedian once, which I know no one would ever like pin me for, and it would be very inappropriate, very dark. It would be definitely incompatible with my current career. But yeah, that was definitely something I dreamed of once upon a time.
Okay, so the George Carlin of
Exactly
ophthalmology.
right.
I don't know. Awesome. Well, Blake, thanks so much for spending time with me. How can
Appreciate
people get in touch with you if they want to learn more about you? Or
any way you want. You can search Blake Hampton on LinkedIn. My first history email address is blake.hampton@firsthx.com. I'm happy to respond wherever works for you. But yeah, I'm an open door. So if you've got questions, I'm happy to answer them.
awesome. Well, that brings us to a close of another episode of Seasoned Advice Live. I hope you listeners have gotten some valuable insights here from Blake that you can implement in your practices. Remember, the journey of business and leadership in healthcare is a continuous one. So keep an eye out for future episodes of Seasoned Advice Live, where I'll continue to bring you conversations with healthcare leaders and practitioners and actionable tactics to help your clinical business achieve potential. So thanks for tuning in, and go out there and lead with confidence.